Okay, I can see it is. And the other one doesn't work, right? Yeah, we are starting this. Audio, can you check if audio works? Okay. We are starting. This week.
Salaam alaikum and a very good evening to you all. Firstly, our apologies for the technical delays that got us late to start. On behalf of MHI, I, Sabira Gracie, would like to welcome you all to our live talk show on kidney health. With us today, we have Dr. Mazhar Amirali, who is an internal medicine specialist and a nephrologist who received his training in South Africa. He recently spent 2 years as an International Society of Nephrology ISN Fellow,
whereby he studied general nephrology, and he was granted his ISN fellowship in November 2019. He is currently practicing as a nephrologist in the Muhimbili National Hospital and is an honorary lecturer in Muhimbili University. We're very delighted to have you here with us today, Dr. Mazhar.
Thank you very much for having me. I'm looking forward to the talk.
So we have this event today to mark the World Kidney Day, which was on 9th of March this year. The theme for this year was Kidney Health for All, preparing for the unexpected and supporting the vulnerable. Let us hear from Dr. Mazhar a little bit more about this theme, please.
All right. Thank you so much, Sabira. So basically what this year's theme was, as you correctly said, that majority of our patients are actually quite vulnerable, and majority of our kidney patients are actually long-term patients. So basically what the theme mentioned, that prepared for the unexpected, basically means is that, if you have got certain sort of natural disasters like, earthquakes or wars or, pandemics like the COVID-19, then what then tends to happen is that our health services tend to get stretched. And, these patients who require chronic treatment tend to get marginalized because all the resources are then put into that particular problem that there is at that particular time. So, and this has been apparent actually in the COVID-19 pandemic, where, we remember how the health sector was stretched. I mean, people in Europe were trying to ration dialysis because they couldn't provide it for everybody. So it was really an eye-opener at that time. And that is why they used, that particularly, and all these other natural disasters that tend to occur, to try and, brainstorm and say, like, what can they do to try and reduce or rather prevent, marginalization of these patients, especially on chronic dialysis and, patients with transplant, to try and avoid this in the future. And this year's theme was basically on that. But obviously today we will be talking more about overall kidney disease, kidney health, kidney disease, and how one can know about it, prevent it, and how it's treated, etc.
Thank you. Thank you for that enlightenment. It shows us how much of a burden and how much of long-term care that people with kidney trouble require. Thank you. Before we actually begin our talk show in detail, I'd like to tell our viewers to please put in any comments, suggestions, or questions in the comment box below, and we will discuss it towards the end of our session. Thank you. Firstly, Dr. Mazhar, what are kidneys and what function do they serve in the human body?
Okay, so I mean, most of us have got two kidneys. Some of us are born with one kidney, but most of us have two kidneys. These kidneys are located actually at our back, so on either side, right, of our back, and they are approximately the size of a human fist, right? So basically, the kidneys are not just there to produce urine. It will be something that everybody will think, okay, yeah, the kidney produce urine. They're actually very complex organs, and they are involved in making sure that the body is working properly, right, by doing certain things, right? For example, obviously the first thing is to remove urine, actually water, by the form of urine. It filters out blood, it filters out the toxins, the food that we eat, the drugs that we have to take, right, cannot stay in the body for too long, otherwise it causes problems. So the blood is filtered through the kidney and it's removed then via, the urine. However, it's not just that, it also regulates the body's pH, or rather the acid-base status, right? And you would see that patients, when their kidneys are not working very well, they tend to become acidic or acidemic, and that then causes them to have suffering. The other thing that the kidney actually does is that it is one of the organs that actually helps in producing blood. So how does it do that? You would say, oh, the blood is produced by the bone marrow. Yes, but in order for the blood to be produced by the bone marrow, it needs a signal. It needs a hormone called erythropoietin to signal that, so that they can make the blood. Now, 80% of your erythropoietin actually comes from your kidneys, right? So your kidneys are a major organ to help produce that blood. And therefore, when the patient is ill, with kidney disease, they tend to lose blood because there's not enough erythropoietin. The other thing that is also very important is that the kidneys are responsible for your overall bone health, right? So what it does is that the kidney is responsible to activate vitamin D. So vitamin D comes from the sun to the skin, from the skin to the liver, and then from the liver to the kidney, where it is then activated in its active form. And this vitamin D then allows for absorption of calcium that we eat from our diet. So you see, majority, it just doesn't allow for excretion of waste products, but rather it's a holistic organ that has multi-functions, and it's very important to take care of this special organ so that you don't run into trouble with all of these particular functions of the kidney.
Right, thank you. So how common are kidney issues in our country? Do we have any studies, especially catered in like Tanzania, which can tell you how common and how significant these problems are?
Right. So yes, we do. So I'll just start overall first in the world, just to give you a perspective of how common kidney disease is. So to put into perspective, 10% of the world population is suffering from some kind of kidney disease. So like basically, if you take 10 people in a room, one of them will have some sort of kidney disease. I mean, that is a lot. If you have 100 people, there are 10 people suffering from kidney disease, right? So that's quite common. And I mean, the number is more or less reflected in the studies that have been done in Tanzania. And depending on who you read, the range ranges anywhere between 7.5% to about 12%. So it comes in an average about 10%. So 1 in 10 people actually are suffering from some form of kidney disease.
Wow. That's quite prevalent in our setting. So what are the basic signs and symptoms that like an ordinary person who has no idea of anything that's going on with his body, what are the signs that they need to look for that make them suspect that this might be a kidney-related trouble or an issue that I'm having?
Okay, I'm glad you actually asked that question, because it is very important, right? Kidney disease, does not have signs until the very end. So when things are now, the building is starting to fall apart is when the signs come up. Early kidney disease does not have signs. You can't see anything that can tell you, okay, you have got kidney disease. Yes, there are certain kidney diseases particularly that may have signs, but majority of our chronic kidney disease patients tend to not have any signs until once things have gone far enough where they are mostly irreversible. That is when you start having symptoms. So for example, you'll have symptoms such as I mentioned earlier in your earlier question, you would have low hemoglobin, so because there's not enough erythropoietin that is being produced. You'd have fluid retention, right, because there's not enough urine that is coming out, or the quality of urine that is coming out is not adequate enough to remove all the fluids. And then you have got a retention of toxins. So whatever that needs to come out via the urine normally does not come out, so you have retention of toxins. And how would that then present with? It would present with things like nausea and vomiting, body itching, unable to sleep at night. And if it gets worse, you can get confused, and people can also get seizures from this, right? Okay. And also, what you can also get is, lower limb swelling all the way up to the body. They say that, the lungs get filled with water, etc., and all of these things. But all of these signs are actually towards the end, and especially for patients with chronic kidney disease. In acute kidney disease, you may have certain signs that you can see them early, but again, the kidney function has to deteriorate to that extent where, it's almost not able to do its work. That is when you get the symptoms. So it is very, very important, and I want my viewers, to kind of take this point, that kidney disease is a dreadful disease. However, it is, in a way, a silent killer. You don't know until it's too late.
Okay, that's interesting to hear. Since you mentioned that many people don't actually show symptoms when their kidneys are actually failing and when they can be salvageable. So by the time they show symptoms, it's when it's already like too late, right? So do we have any specific age groups or any specific population with certain conditions who we can say are at a higher risk of developing kidney issues?
Yes, so what we're looking at basically is we're looking at screening for kidney disease. And there are particular, populations, particular, risk groups that we would like to, try and screen for. The most important ones are obviously the non-communicable diseases, right? So non-communicable diseases like diabetes and hypertension. So if you are diabetic, if you are hypertensive, these are the most common diseases in the world that cause kidney disease. So these patients should be screened regularly, at least once a year, right? For the kidneys and obviously other organs that can be, involved with diabetes and hypertension. The other thing is that if you get any form of acute kidney injury, so if you get sick and your kidneys get damaged and then they recover later on, you are at risk of developing chronic kidney disease later in life, okay? The other thing is that if you have got a family history, right? So if there are diseases in the kidney that run in families, and if you have a positive and a strong family history, you would want to screen, those patients. And then anybody that, is above the age of 60, I tend to bring it down to age of 40, right? Should get at least once a year screening to just make sure that the kidneys are, okay, and there's no problem with that, right? The other thing also is that people who are on chronic medication, right? There are certain medications that can interfere with the kidney function, and that also tends to, to cause, kidney problems, and they should be screened for that holistically.
So other than conditions that they have, like this non-communicable diseases that you mentioned, there are certain lifestyle or dietary factors that most people are pretty oblivious about that can actually contribute, or once you have a pre-existing condition, worsen it. So what are those lifestyle factors or dietary factors?
So basically it comes down to the same thing, right? So, whatever would cause you to have diabetes or hypertension, right? So lifestyle, sedentary lifestyle. So, work home, no physical exercise, right? Or, gaining of weight, right? So eating the wrong food, okay? Eating more sugars, more carbohydrates, right? That make you become obese, and, lack of exercise would then cause that. And then obviously other things, use of cigarettes, of alcohol, right? These things are things that may also lead to disease, chronic kidney disease later on, or it may perpetuate. If you already have it, then it can progress it, further. So we have to have a balanced diet. We have to have a healthy lifestyle, right? Eat the right food in the right portion. Do not overeat, right? Exercise. Make sure that you are, getting up off that couch, walking, for let's say 30 minutes a day, 5 times a week, 3 times a week, whatever it is that you can do. Make sure you watch what you eat, because we are what we eat.
Definitely, yes. So suppose we have a patient who probably suspects or is actually getting themselves screened. When they come to a doctor, what are the things that a doctor wants to look for in them? How, in other words, how is a kidney condition diagnosed?
Okay, so it's very simple. We can just do a couple of blood tests and a urine test, and we have more or less have our answer. So it's fairly straightforward. We check something called the creatinine, which is one of the major waste products that is released from the kidney. And if you have a kidney problem, there is a certain level that it has to be at. If it's not at that and it's higher than that, then we know that there is a problem with the kidney. However, there are certain kidney diseases that may have a normal creatinine level, but they are quite prevalent in the sense that you may actually have protein that is leaking in the urine. Normally, you should not have protein leaking in the urine. Your urine more or less should be bland. There shouldn't be sugar, there shouldn't be protein, there shouldn't be blood, right? There shouldn't be pus cells. If any of these things are there, especially protein, right? Even if the kidney function is normal, it means that there is a damage in the kidney. And we need to make sure that we follow this patient up regularly and make sure that we find the cause why this patient has this particular ailment, to try and prevent the patient from progressing, right? So basically these two things, your kidney function, your creatinine, and your urine to check for proteinuria. And those are the two things that we usually check as initial screening. Once we get once we get these, then we go ahead and do other specific tests to make sure that we find the cause. If we don't know the cause, if the patient is diabetic or hypertensive, then we can try and see if we can correlate what is happening in the kidney is actually from the, from the diabetes or from the hypertension.
So if we have a patient who has the diagnosis of an acute kidney injury or so for the first time ever, he's never had this ever before, what are the treatment methods for this? Because you mentioned that we actually look for the cause, and I believe if you treat the cause, most likely your kidneys are going to heal and get better. But are there any specific medications or anything that we can do just at that one time for the kidneys, or any medications right there?
So it depends on what kind of kidney disease you have. I mean, if you have got acute kidney injury or acute kidney, dysfunction of the kidney, then yes, then there may be something that is reversible. It usually is reversible, right? And what we want to kind of do is we want to kind of find the cause. So say, for example, if somebody is sick with malaria, right? Severe malaria, he's not had treatment, and all of a sudden, the malaria is so high that it goes into the kidneys. If you were to treat the malaria, treat the patient supportively, give the patient fluids, you would expect once the malaria is gone, once the fluid, is in there, the kidneys should slowly start recovering, and they do, right? But if the problem is, say, a chronic problem, right? It's been there for a while, then it depends on how they present to you, when they present to you in their disease. And initially, the early stages of the disease, you can try and control the risk factors for the progression. So for example, if it is diabetes, make sure that the diabetic control is very good. Make sure that if the patient has got protein, you give them certain medication to try and remove the protein from the urine so that the kidneys are protected. You try and also counsel them on making sure they don't take any drugs or any other products that can actually damage those kidneys further. So what you're trying to do is you're trying to damage limit, right? So that is for chronic kidney disease. For acute kidney disease, you try and look for the cause, you treat the cause, you support the kidneys, and if they require to kind of have dialysis, etc., you go in and you do that until the kidney recovers sufficiently enough to be able to take over the function that it normally does, and you remove all of your supportive therapy and counsel the patient for regular follow-up and make sure that they don't progress towards chronic kidney disease.
You mentioned dialysis. What does dialysis actually do? And if you start dialysis once, does that mean you're going to be on dialysis like forever, or are there times when you can, stop or?
Okay, thanks for that. So basically dialysis is a filter. That's what we kind of, call it in simple terms. So the blood comes out of your body, it goes through a machine that is full of pumps, right? It goes through a filter. The dirty blood goes into the filter, all the dirt comes out, and then the clean blood is taken back into the body. That's basically it, nothing else, nothing fancy more than that, right? It's just a filter. Now, with regards to the question, it does not replace your kidney, right? So I've heard people calling it the artificial kidney. In a way, yes, it is an artificial kidney, but it does not replace your kidney's function. You still have to kind of give all the other drugs that would keep your body's blood level okay, your HP okay, your vitamin D level okay, your calcium level okay, your acid base okay, right? Because the dialysis, what it does is just basically, it filters your blood, removes the toxins, and returns the clean blood back into there. Now, to answer your question, if you start dialysis, do you remain on dialysis? That depends, right? It depends again on what kind of kidney disease you are treating. If you're treating an acute disease, a sudden collapse of the kidney, you treat that patient with dialysis until those kidneys wake up. Once they wake up sufficiently, and you're sure that this patient can do without dialysis, then you stop dialysis. Then you stop dialysis, and the patient the kidney takes over, and they get better. But if the patient has got chronic kidney disease and fairly advanced chronic kidney disease, the chances that they will recover from that is minimum to none. Because remember, chronic kidney disease is a progressive illness, right? It starts off from stage 1 all the way to stage 5. And once you reach stage 5, you can't go back to stage 4. If you're stage 4, you can't go back to stage 3. So it is a progressive disease. You want to kind of try and keep yourself at stage 1 or stage 2 or stage 3. But once you progress further, you can't come back. And dialysis does not cure your kidneys, especially in chronic kidney disease. It is a supportive therapy. It's not a curative therapy, right? So what we do with chronic patients is that once they have to start dialysis, which is usually once they have got stage 5 kidney disease, we start them on dialysis. And the aim is to kind of get them towards kidney transplantation, because that is actually the definitive management. You want to give them a new kidney so that the kidney can actually take over the function of those diseased kidneys that are not working anymore, right? So we use that as a bridge to keep the patient alive until they are able to get a kidney transplant. But say, for example, for whatever reason they are not able to get a kidney transplant, then they can remain on dialysis for as long as, you know, we are able to access their blood and filter that blood for them.
So does that mean that once you have chronic kidney disease of whatever stage, there's almost no chance of you to go back and have a healthy functioning kidney again?
Yes, in all likelihood, no, right?
All right.
So as I said, like, you know, chronic, that's why it's called chronic. It means that it's long-term progressive kidney disease, right? So once you have it, you have it. But what can you do about it? Then that is why we try and screen our patients, especially those who are at risk, to try and pick them up early. Because if we pick them up early, what we can then do is we can make sure that they do not progress to the advanced stages. So in that way, you can still live a normal life, right? You don't need dialysis, you just eat whatever it is that you need to eat, but in moderation. Take your medications regularly. There are certain other medications that help you prevent, you know, risk factors to prevent, you know, kidney worsening, etc. You may have to modify your lifestyle a bit, but that kind of keeps you away from dialysis and you can still live a healthy, normal life, right? But if you have got acute kidney injury, the kidneys may recover. Chronic kidney disease, the likelihood that the kidney is recovering is very low, right? And as I said, it's a progressive disease.
Yes, I understand. So we've talked about pharmacological management, the medications that they can have, the dialysis, and the possible transplants when the patient can. So other than medications, a lot of people talk about a renal diet. There's certain foods that they can have, and certain foods are absolutely no. So can you enlighten us on more explicitly, like what foods they should avoid and what's recommended for them to keep having?
Okay, so thanks for putting that out. So remember that you don't really need a renal diet if you are in your early stages, right? So stage 1, stage 2, stage 3, you really basically can eat what you usually eat. There's no problem with that, because at that time your kidney is still functioning. Both of your kidneys approximately are functioning up to about 35-40%, right? So it's okay. You can kind of eat more or less a normal diet. But once you get to the advanced stages of kidney disease, so basically once your kidneys are now functioning less than 30%, things start accumulating, right? As I said, the toxins accumulate. So things like electrolytes, which are not supposed to be there at higher levels, start accumulating, and that can be detrimental and actually life-threatening to patients. So that is when we start now to tell them, okay, listen, you can't eat certain kinds of foods. So what is this electrolyte? The most important one is potassium, right? So you want to try and make sure that the potassium level in the blood remains more or less at a recommended level so that they don't get problems. And foods that are rich in potassium are fruits, right? So any kind of fruit that is more or less in yellow color, so bananas, mangoes, papayas, right, pineapples, all of this have very high quality content of potassium. So you want to try and limit. We don't tell them don't eat it completely, right? We can tell them, listen, you can have a bit. It's recommended not to, right? So things like avocados and guavas and peaches and all of these are things that you would want to avoid. As more advanced you get, the more strict we get, right? But the other food, more or less, you can eat more or less everything. If you're hypertensive, we recommend you not to have a lot of salt in your diet because you want to keep your blood pressure okay. And as the kidney disease advances, we try and reduce the amount of red meat, right? Because meat, as it gets into our body, it's converted into acids, so amino acids, and that kind of causes the acid level in the blood to go higher. So we're trying to keep that down. But also, the uric acid level tends to also go higher because it's not excreted. But then again, you're taking in animal protein. So that can also cause that, and it can be detrimental to the kidney itself. It can also lead to progression of kidney disease. So we tend to try and limit that. But initially, the first stage, second stage, third stage, we don't really push harder. We are a bit more, liberal. But as we go ahead at stage 4 and stage 5, we become a bit more conservative and a bit more strict.
Throughout here, one thing has been constant, that hypertension and diabetes cause kidney injury. Most of the time when someone is diagnosed with hypertension, their first organ to be affected according to their head is probably the heart. So how does high blood pressure, which primarily affects the heart and the blood vessels, can actually make your kidneys fail that you actually need to go for dialysis or transplant? How does that happen?
Right, thank you. That's a very nice question. So remember that, I know people think hypertension is heart, but actually hypertension is kidney. Because the major organ to control your blood pressure is the kidney. It secretes hormones that regulate your blood pressure. It makes it high or low, right, in certain situations. And I mean, my medical viewers will understand this much better. But any sort of kidney disease, right, will lead to hypertension if you're not hypertensive, right? Because now there is dysregulation. There is no more consistency with that kidney because that kidney is deranged, it's damaged, so it's not thinking, is so you put it, right? And you will have actually high blood pressure. So you can actually have high blood pressure from kidney disease. So it's not like the high blood pressure is causing the kidney, but it's actually a consequence of that kidney disease that you have hypertension. However, if you've got initial hypertension, like proper, just, essential hypertension, and the kidney was okay, but you have not been using your medication properly, the blood pressure tends to be very high. And remember, the kidney is very small, and it's got very small blood vessels, right? So imagine now that the blood pressure is so high in your big vessels that it makes your heart become bigger, right? That's how significant it is. So what happens to those small vessels, right? So those get damaged. And once they get damaged, there is not enough blood that goes through the kidney, and the kidney then dies, right? So it's like the chicken and the egg, which comes first, but you can have kidney disease causing hypertension, or you can have poorly controlled hypertension at the beginning that can then later on lead to kidney damage.
Right. So chronic kidney disease and kidney problems are something that are progressive, and very likely patients will have to live with them forever, right? And as human behavior, as it goes on throughout the day, there can be times when they do not adhere to their medications or can have new symptoms that they probably overlook or miss appointments here and there. What are the common complications from a patient who already has kidney problems from CKD? What are the possible complications that normally present?
Okay, so as I mentioned earlier, I mean, if you keep the kidney's function in mind, right? Once the kidney deranges, more or less all of those functions are deranged, right? So if you are not following up regularly, or if you're not taking your medications that you've been prescribed, you will get those complications. So complications like, for example, your blood level goes low, right? Because there's not enough erythropoietin. So what we then tend to do is we tend to give our patients erythropoietin as an injection. Just like you would give a diabetic patient insulin, we give our patients erythropoietin as an injection. Now, if you don't use that medication, then your HB level is going to drop. And once your HB level drops, you don't have enough oxygen carrying capacity. Therefore, you feel tired. You can't walk from here to there, right? You feel dizzy and all of that. So your quality of life doesn't stay, good. That's one. The other thing is that, say, drugs like, calcium and vitamin D, which is something that we have to now supplement. Why? Because the patient's kidney is not making that anymore. Right? And if you don't use those medications, or if you don't follow up to refill your medications, you may actually compromise the integrity of your bone health, and you may be prone to fracturing easily. And remember, if you fracture, then the morbidity or the problems that come after that are much more higher. The other thing also is obviously depending on what stage you are at. And if you were, say, for example, we are giving you medication to make you urinate more, to try and make sure that you don't retain water, and if you don't take those medications, or you don't come and refill that, you start filling up, right? And believe me, you don't want to experience how it feels when you have got water in your chest. You can't breathe, you are grasping for air, right? So it's not a very nice feeling to have. And then for patients who are already, say, on dialysis, right? If you miss your dialysis session, all of those toxins, fluid, and everything that we usually remove with dialysis tends to retain. And once that happens, again, you don't feel good, you feel very sick, right? You feel more or less what you were feeling before you started dialysis. So it is very, very important to be compliant on your treatment, to follow up on your treatment, right, to prevent all of these complications that is happening. And obviously it becomes even more complicated when you are a transplant patient, because when you are a transplant patient, we tend to give you medication that reduces your immune system so that you don't reject that kidney. The moment you don't follow up regularly or you don't take your medication as prescribed, you can actually lose that kidney. And there aren't many kidneys available in the world. I mean, there are people in the hundreds of thousands on a waiting list waiting to get a kidney. So you need to really protect that organ. It's a very vital organ.
Yes. So above all, how does an asymptomatic person, a person with literally no symptoms, screen themselves? How often should a person with no comorbidities or one with hypertension and diabetes screen themselves while they don't have any symptoms? And when they screen themselves, what specific thing are they looking at?
Okay, so it's very important. I mean, it's easier for people who are actually sick with diabetes, hypertension, and any other form of chronic illness, because when they come in for their drug refill, so they come in and Daktari, I've come to take my medication. So then you use that opportunity to ask them how they're doing. If they have what, they may have symptoms they may don't know. They may have feet swelling up, but they say, no, but I work from morning till evening and that's why my feet are swelling up. They may not know that actually that may be one of the telltale signs of kidney disease, right? So you would ask them how they're doing, if they've got anything new that has come up or something that they may have noticed, but they don't know how to explain it or they've explained it something else. So that is one thing that you can do. The other thing is that when they come in for the refill, you can tell them, okay, listen, we are going to check your kidney function today. Let's see how it is. If it is normal, then we are not going to do anything until next year. So you use that, you try and kind of screen your patient and make sure that you've checked more or less everything for their comorbidities. If they're diabetic, you check the sugar control, you check the cholesterol, you check their kidney function, you check the urine, etc., etc., etc. You do the same thing for your hypertension patients, right?
You recommend all this once a year, or?
So that's what I'm getting at. So if it is all normal, then you do it once a year, because it doesn't make sense to repeat it regularly because you still have the same report. So it's financially not kind of sound. But if you have a patient who has got an abnormal kidney function, then you screen them more regularly, because now you want to find out, okay, this patient has an abnormal kidney function. Is this patient progressing or not, right? So depending on how frequently you do it initially, you can do it every 3 months, right? Or every month initially, okay, it's not progressing. Every 3 months, it's not progressing. Every 6 months, it's not progressing. Every year, it's not progressing. Okay, then you do once a year. But if the patient is progressing, then you would do it more frequently. Because what you want to try and do is you want to intervene. You want to block that progression. You don't want that progression to worsen, right? So this is for people who are sick, who have diabetes, who have hypertension, who have heart failure, etc. But what if patients are not sick and they still want to check the kidney function? That is fine, but I would recommend, if you do not have any risk factors, so you don't have risk factors for diabetes and hypertension, you don't have a family history, you are exercising, you're eating healthy, you're not obese, etc., right? You don't have a family history, you don't smoke, etc., etc., all of those things, then don't screen yourself before the age of 40, because in all likelihood you won't really have any sort of kidney disease. Unless if you got ill recently, then yes. I mean, if you had an acute kidney problem, you had malaria like 10 years ago or 5 years ago and they said your kidney had a problem, you should screen that. You should actually screen more regularly, even if you are less than 40. But say you are completely fine, completely fit, never really fell sick, right? Then you start screening yourself after the age of 40. The reason why I say that is that once we reach the age of 40, our kidney starts to age, right? So normally our kidneys are functioning at 100%, and then slowly after the age of 40, we drop 1% per year. Whether you are fit as a horse or not, your kidney function will drop, all right? And that is something that we should look forward to kind of, have that in our minds and make sure that we are being proactive. Once a year, again, is more than enough. You just come in, you do your health checkup, whatever it is that you would like to do, check your kidney function, check your urine. Sometimes you may have a disease that may not be showing any symptoms, as you correctly said, and we may then pick it up that way as well. But you see, because the reason why I don't suggest people screening, especially if they don't have illnesses, it causes you anxiety, right? So you do not want to do that unless if there is a very valid reason for doing it. But people who are sick, people who have got risk factors should screen more regularly compared to people who aren't.
One more thing. Role of, when it comes to pregnant women and kidney-related conditions, because some people don't have any renal issues, but once pregnancy kicks in or stuff, they start noticing swelling, or they start having now kidney issues, or even postpartum. What's your say on this? Like,
Well, yeah, I mean, it is there, and it's very unfortunate and sometimes unlucky on the mother's side. I mean, because pregnancy is a physiological state. It's not a pathological state. Somebody would argue that it may be a pathological state, but it's a physiological state. But unfortunately, these things tend to happen, and that is why you would see that when you do fall pregnant, you are actually recommended to go through your antenatal clinics more frequently, right? And they give you that schedule that you need to go through every 3 months, or whatever it is that they provide. And the reason for that is to kind of try and pick up these things earlier, so that you don't end up with kidney disease, right? Because the things that you are mentioning are, hypertension or high blood pressure in pregnancy and kidney disease in pregnancy. All of this comes because the placenta is not attached very well to the uterus, and that then causes all of these problems. So it is important that if you are pregnant, you follow up with your clinic and try and get screened, because that's what they do. They come in, they do your ultrasound, etc., but they also check your urine to see if you've got protein. They also check your blood pressure to see if your blood pressure is elevated. And the moment they start seeing those things, then they red flag you, and they make sure that they follow you up more closely. So yes, it is common, it does occur, and I have seen patients, losing their lives because of poor adherence to their clinics. So one recommendation that I would give is, if you are pregnant, follow up on your clinics, make sure, everything is checked, your urine is checked, your blood pressure is checked, to make sure that you are not heading towards those complications, right? And I mean, the risk factors that are there for people who can get this is that if you are first time pregnant, so that can cause you that. Not everybody gets it, but it is something of a risk that we have seen. If you have got multiple pregnancies, so if you've got twins, triplets, etc., the more babies you have in your tummy, the higher the risk, okay? If you have already had this before, say in your first pregnancy, the chances are that you can get it in your second pregnancy. And then if you already have, say, high blood pressure before you start pregnancy, the chances are that this may worsen while you are pregnant. Or if you have got any other, kidney disease that you had before pregnancy, that can also kind of worsen as well. Or if you had, certain other diseases, something like lupus, that, kind of is quiescent, but when you get pregnant, because of the hormones, it flares up. So that can also lead to kidney disease, right? And then obviously there are other things like, the baby doesn't grow very well, and the baby can die in the stomach, and that can then also cause, kidney problems and liver problems, etc. So there are multiple things that can occur, but it's very, very important to kind of follow up your health. And you see, more or less, it's clinic visits, screening, clinic visits, screening. And this is the only way we can kind of pick these things up. It's very difficult for a lay person to know what's going on, and that is why we recommend them to come through.
before we start discussing the questions in the comment box, what's your take-home message in a nutshell to the general?
Okay, so my take-home message basically is, kidney disease is common. It does not present with symptoms until it's very late. And, the most common causes are diabetes and hypertension. And we should make sure that we should be proactive in our health, in our lifestyle, right? We should have a healthy life, we should eat well, and we should make sure that we should be screening our health and make sure that our kidneys are safe, because we need to protect these precious organs so that we don't get problems later on. Thank you.
Here we have a question that says, how much water are we really supposed to have to keep our kidneys healthy? There is so much information out there. Some say only drink when thirsty. Some say drink at least 2 liters.
Okay, thank you very much for whoever asked that question. That's a fantastic question. And I love answering this question because I always get to this question whenever I'm seeing patients. So remember, your kidneys are very smart, right? Your body, as a human being, you are a complex organ, So the body will tell you when it needs water. And the only way you know that you have to drink water is by feeling thirsty. The moment you feel thirsty, your body is telling you, okay, this is a signal, you need water, right? There's no set standard. I mean, somebody can drink 1 liter a day and he's fine. Somebody can drink 3 liters a day and he gets kidney disease, right? So the reason why I say this is that you look at the cues, right? If you have a headache, there's something wrong, right? You're either tired or you go sick or whatever. Listen to your body. If your body tells you you are thirsty, you need water. So you drink water as you feel thirsty. The moment your thirst is quenched, you stop. I mean, I don't find a reason to walk around with a bottle of 3 liters and, every time you're chugging water. The only thing that that's going to do is make you go to the toilet more often, right? It's not going to do anything better than that. So I suggest drink when you feel thirsty. The quote that, they say is drink 2 liters a day or 8 glasses of water. This was an anecdotal thing that was published in the 1950s when somebody just decided to say that. But there's no objective evidence to say that you need to drink that much water, right? Your body will take what it needs, the rest of it will come out in the urine. So drink when you're thirsty. That is my answer.
Right. This one's quite an interesting one. It says that they've been visiting herbal doctors and using medication. Do they have a side effect? I think this is quite important because many people, once they're diagnosed with a lifelong condition, they tend to opt for, any possibilities to actually cure it completely, and they get into herbal medicines or things like that. What's your...
Okay, thank you very much. This is actually a very important topic, and you'd actually be surprised. The numbers show that the amount of traditional medicine or herbal medication that is utilized in Tanzania is about 70%. So 70% of people actually use this medication in one way or the other. Now, I want you to just understand one thing. Herbal medication equals to natural medication, but nature is not always safe. It may be harmful, right? So I usually give my patients an analogy. So all of us eat bananas, right? But we peel the banana and eat it, right? But it's a naturally occurring fruit. Why don't we eat it with the peel? Because there's no nutritional benefit and it's sour and whatever, and you don't know what's going to do. So you're going to peel the banana off and eat the fruit that is inside. So being natural doesn't mean it's safe, right? And herbal medication, the issue with herbal medication is, yes, there are certain herbal medication that have been studied, proven and shown that there are benefits. I mean, honey and cinnamon, you take that, for upper respiratory tract infections. These things have been studied and they've shown that no, actually, they have better outcomes than conventional medicines. So we know that. But majority of the herbal medications are actually not studied very well, or we don't have enough information, right? And given the fact that it's herbal, we don't know if it's safe or not. And the other thing is that you may use a certain amount and get better. If I use the same amount, I may actually get very sick from it, right? And it's not just your kidneys that can get damaged from this. You can even get very bad liver disease from it, right? So you do not want to do a trial and error. The reason why we kind of give medicines to our patients is because these medicines have gone through a rigorous investigative process to make sure that these drugs are safe for human consumption. It's not the same for herbal medication, especially those that have not been studied. And patients that come in to me, they will say, I went to Mganga, this Mganga told me go to the forest and take this plant and crush it and drink it. We don't know what the effects of that particular, drug is, and how does it measure what concentration you are getting, what concentration I'm getting, how much I should drink, how much I not drink. So you see, so it's not safe. And I would suggest that if you have got any sort of chronic illness, go to your doctor, sit down with your doctor, let him teach you, let her teach you about your illness. And if you're still not happy, seek a second opinion. You can go to the internet, there is enough information for patients to kind of know about the disease. And if there is any questions, you go back to your medical professional, tell them, listen, I read about this, 1, 2, 3, 4, right? Can I use this, can I not use this? But do not try and kind of circumvent the situation that, oh no, I'm not going to take medicines because herbal medication is natural and it may not have any side effects. It may not have any side effects because we don't know if it has good side effects, right? And use your medications because your medications are the things that are going to make you feel better. They are going to cure your illness or at least protect you from getting worse. And these drugs, as I said, have been tested rigorously and they have been made sure that these are safe for human consumption. So, I mean, it wouldn't make sense I give you a tablet that is actually going to cause you more harm. Then what have I done? Instead of curing you, I'm making you more sick. That doesn't make sense, right? So please try and avoid these and, go through your conventional route, go through your doctor, take your medications regularly. And if you have any questions or if the medications are causing you side effects, there are always alternatives. You have to discuss with your medical professional. It is your right as a patient to ask questions and to learn about your disease.
We have one question here that says, what is burnt out diabetes? They say that their sugar levels surprisingly became fine after they began having kidney issues, such that they no longer use any amount of insulin anymore, despite whatever they eat.
Okay, that's a very good question. Thank you for that. And I mean, you'd see majority of the patients that come in with kidney disease tend to kind of have this issue that they've been, they were diabetic and now they don't use the diabetic medication anymore because their sugar drops precipitously down. So they tell me that I was diabetic, but I'm cured now. So the answer is not that they're cured. The issue is that they actually have advanced kidney disease, all right? The kidney disease has progressed so much that the insulin that is produced, the little insulin that is produced from the pancreas, kind of stays in the system longer. Remember, I told you earlier with the kidney function, your kidney is responsible for removing drugs that we consume out of the kidney. Now, if there is no kidney function or very little kidney function, there is no filtration, there is no production of urine, that particular drug will remain in the system for longer. And the insulin that is produced by our pancreas tends to stay in the system for longer, and therefore the sugar levels remain kind of constant. So you're not cured of the disease. On the contrary, right, your insulin levels that are produced, right, in the body are not excreted adequately enough, and therefore your sugar remains constant. Now this same patient, if you transplant them, once the kidney function kind of normalizes because now they've been transplanted, the sugar will spike up again, all right, because you've now removed that blockade that, the insulin now freely is filtered in the kidney, it's denatured and it's come out, and, your sugar level come back again. So you're not cured, but it's because of the effect of your kidney disease. So if at all you've never checked your kidney disease and all of a sudden your sugars are now perfectly controlled without any medication, I'm sorry that you may actually be suffering from kidney disease.
I think we'll just take 2 more questions. Yeah, right? This one says that, why is it that when I urinate, there is no urine that comes out initially? It comes out later, and then there is still some left, so I have to wait for the remaining to come.
Okay, so this may be more of a urological question, and it also depends on who it is, if it's a male or a female. So if it's a male patient, it may be a sign of, of an obstruction towards the urine that's coming out, and again, depending on your age, right? So it may be a prostate enlargement that is causing this, so it may be one of those signs. Or there may be a certain blockade that medically we call it a stricture that may be leading to that. So I would suggest if you're actually getting that, you should see a urologist and get further investigations done to make sure that, that there isn't such a thing. For a female, fairly similarly, again, it may be a stricture that is blocking there, or it may be an obstruction, maybe from the cervix, maybe you've got a tumor there that is causing that, or you may actually have a urinary tract infection. So you may not be feeling feverish or pain when you're urinating, but your urine that is coming out is not adequate enough, and because there is irritation there, and that is why. So you should actually go ahead and check your urine, get a urological or a gynecological assessment to make sure that everything is okay there.
Right. Last one. This is quite interesting. Is the kidney involved in making us resistant to medicine? There's a lot of talk about antimicrobial resistance now. Is there any way that the kidneys are also involved in this?
I don't think so, because what the kidney does with medicines basically is that it metabolizes them and it excretes them. So it breaks them down and gets them out. The way, antibiotic resistance, antimicrobial resistance we're looking at is it's probably overprescription of drugs. I mean, that is probably your biggest threat, right? I don't think so the kidneys have got anything to do with it. On the contrary, they just kind of try and get rid of your medications out of your system. So I don't think there is any link with that.
Right. Thank you so much. I believe this session has been very, very beneficial to all of us, and we have all learned a lot from you, Dr. Mazhar. Thank you so much for your time here with us. We really appreciate you here. With that, I would like to end this session. Do you have something to say?
I just wanted to say the pleasure is all mine, and I would like to thank, KSIJ, the CMB, Care Space, and MHI to help, bring this to our audience, because I believe that, kidney disease is something that is a neglected disease, and the awareness is not out there. So as much more awareness we can bring out to our community and, the population at large, the better it is, because kidney disease is not stopping. There's a pandemic of kidney disease in the whole world, and especially in developing countries like ours, where, things are on the rise. So we would like to kind of go towards the grassroots and prevent this disease before they actually happen, Otherwise, we are going to be in big trouble, later on.
Yes. Thank you. Thank you so much. With that now, I would like to end this session. Thank you all for watching this.